Hello, my name is Richard Smith, and today I'm going to be discussing quality assurance in the business workplace. So when people first hear the word quality, they might think of something that is built well or well made. And the field of quality improvement really is just that, ensuring that the quality of goods or services provided is of the finest quality. Therefore, quality assurance is any systematic process of checking to see whether a product or service being developed is meeting specified requirements. Now for this presentation, I interviewed Adria Smith, the Quality Informatics and Compliance Coordinator for PACE of the Triad. PACE is a program for all-inclusive care of the elderly, and Adria has 16 years of experience in quality and compliance. PACE is the highest rated program of their kind in the state. Many people think of quality assurance as risk management, and there is some truth to that. But in reality, they are often change managers. Now, change is not for everyone. In fact, change scares most people. When applied to business, Maslow's hierarchy of needs indicates that people are only able to change and transition when certain base needs are met. So today we're going to discuss how both quality and informatics represent fields that are all about change. They recognize a world that is fast-paced and constantly seeking to find a better way of doing business. Quality ensures a high level of excellence by tracking and analyzing data, developing policies and procedures, and most importantly, providing change management. Now, you can't tell where you're going if you don't know where you've been. So quality assurance starts by utilizing the most advanced technologies possible to compile, track, trend, and report. How do they track? Now, PACE uses Six Sigma, Agile project management, and basic root cause analysis methods to make sure that they're making the best actions for improvement with their data. But the real magic is found in the software and information systems they use. In addition to an electronic medical record, they use a system created by MySQL and Microsoft Power BI to get real-time visual on their data rates. What do they track? Well, businesses must determine the indicators for success in their business. In the healthcare field, those indicators are health outcomes. In sales, that might be the rate of sales success. These indicators are most commonly measured over the course of time in order to analyze and predict trends. Now, what is done with this data? Data measures are used in developing policies and procedures to ensure quality outcomes. So policy and procedures come out of analyzing systems to correct what is failing. If it is determined that a process is failing, a root cause analysis is done to determine the root cause or causes that led to the breakdown. Now, if it's broken, how do you fix it? Well, documentation is key to developing a plan of action in order to fix a failing process. Next, you're going to test it out on a small scale, i.e., for example, only in one department, only for certain patients, or only for a short time, before making any broad changes that may not work. Finally, you're going to measure twice and cut once. So after the change is in place for a bit, you're going to come back and measure it again to see if the change fixed the failing process. If it has, then we can implement it on a wider scale. If there's no measured improvement, well, it's back to the drawing board with another root cause assessment. Now, once you've figured out what the failing process is and what works to fix it, how do you make that change? That's where we come to quality coordinators as change navigators. As we said before, change is not for everyone. In fact, change scares most people. So it's important to remain as transparent as possible. Communicate openly about the need to change to stay abreast of the changing times. And secondly, you're only going to make changes that are necessary. Things might go unnoticed, or there could be a negative ripple effect if the wrong information is relayed or a change is implemented without careful attention. So you don't want to make too many changes at once or changes that aren't necessary. And finally, you need to do change that you can believe in, which means that employees must have confidence and trust in a change in process in order for the transition to go smoothly. When it comes time to implement the change, you need to provide staff with adequate training and be on hand to help continue to guide them through that process. So you need the input and collaboration from your team members and associates at all times in order to make sure that the changes you will be implementing are effective and realistic for every role in the agency, from accurate collection of data to openness to new ideas and their implementation. So let's summarize. Quality determines the indicators for success and then compiles, tracks, trends, and reports that data. These data measures are used in developing policies and procedures to ensure quality outcomes. And finally, quality is change management. Often human perception can cloud the information that data tells us. Sometimes what we perceive to be true actually isn't, and the numbers can remind us of that. However, we do have to be careful not to completely remove human intelligence, that part of us that asks, why? And when we look at the set of data that trends, this human part of us is invaluable when it comes to knowing not only why data behaves the way it does, but also what to do about it. Without that, quality would just be looking at numbers.